Hello. Good afternoon, everyone. I welcome you all again today for again a different FB Live session on breastfeeding. Today we have chosen a topic which is not related to fertility as such, but it's related to the motherhood. It's related to womanhood. It's the most important thing a woman experiences in her lifetime. That's the motherhood. And most important part of this motherhood is, of course, the pregnancy, but more so the breastfeeding and the bonding and the attachment of the baby and the mother. I, Dr. Nilesh Balkawade, Clinical Head, Oasis Fertility, welcome you to today's session on breastfeeding practices. August is a month which is considered as breastfeeding month because the first week of August is breastfeeding week. That's why we have included this topic for the discussion today. So basically, our demands as a child are very less. As we grow up, our demands come go on increasing. But as a newborn, we have only three demands, and those are warmth of the arms of mother, food from mother, and shelter or security. In the known aspect of the mother, we have had that security in the mother's womb, and once we are outside, we want that security again. So all these three demands are satisfied by breastfeeding, and there lies the importance of breastfeeding practices. A lactation is that part of a mother's life where the demand for nutrition, the demand for protein requirement all goes very high. We all see that all the festivities associated with pregnancy are usually there during the pregnancy period. We have the 7th month festivities and so on. But if we see that the breastfeeding and the lactation part, which is the most important part, where the energy requirements are very high, is most often the neglected part of a woman's life. Lactation is a period where there is extra phase of nutrition which is needed by the mother. We always give a pregnant woman extra nutrition in the form of extra calories, which is around 300 kilocalories extra over her daily requirement, and a protein requirement which is also a little bit more. The iron and calcium requirements also go high. But when a mother becomes a lactating mother, she starts to breastfeed. These requirements are dramatically increased, where the calorie requirement jumps up to the total calories which she takes plus 550 kilocalories extra, and the protein requirement jumps to around 1.5 gram per kilogram of her body weight. The iron and calcium requirements are also quite high, and it's very important for us to maintain this nutrition during this period. So, starting with the nutrition of the mother, we will stress upon the importance of breastfeeding. Breastfeeding, as we all know, is the feeding of a neonate, a newborn, with breast milk directly from the female breasts. We know that what is adequate breastfeeding and what should be the procedure for breastfeeding. So, usually, breastfeeding should be initiated on demand so that whenever the newborn is hungry, he or she should be supplemented with breast milk. Usually, if the mother is not accustomed to feeding the newborn or getting to know that newborn is hungry, it's usually recommended that the mother does a breastfeeding for every 2 to 3 hours. A short courses of breastfeeding initially can suffice the appetite of around 10 minutes or so. Later on, this has to be increased to around 20 to 30 minutes duration. This is done usually 3 to 4 hours. We know that currently we practice rooming in practices. As soon as the baby delivers, it's kept on the mother's lap, and then the baby crawls up on the breast. This is called as crawling, or this is also called as kangaroo birth. In kangaroo birth, immediately after delivery, may it be a normal delivery or a cesarean section, the baby is allowed to crawl upon the abdomen, and the baby goes and finds the breast for itself and latches onto the breast. This gives the baby the tactile motility, the mobility, also the the senses are developed. So all this will help. This breastfeeding started immediately after delivery within 30 minutes, that's the maximum time, is continued for around 6 months. We give the baby nothing else but breastfeeding during this period. This is very important because the baby is not only going to receive nutrition, but the baby is also going to receive some important uh, chemicals from the mother's body, which are called as antibodies, to fight some infections. The baby is also going to get a sense of bonding with the mother. All these advantages are going to come. So, breastfeeding immediately after delivery, and it is continued till around 6 months after birth. Types of milk, if we see it, they are divided into the first few hours or the first few days of the breast milk are composed of what is called as colostrum, and this early milk is yellowish in nature, and this gives lot of antibodies which are rich in IgA, immunoglobulin A, and a lot of protein to the baby. They also serve to increase the immunity of the baby. This is produced till around 2 to 3 days. That's why this is scanty in nature, and therefore the mothers tend not to feed. But this is the time which should be the mother should be initiating breastfeeding, and this milk should not be wasted, should not be thrown away. Then we have a little bit watery milk coming in between. This is called as transitional milk. This is around 3 days of delivery to around seventh day of delivery, the first few days, where the water content of the milk is very high. It's lower in protein, but it's more composed of carbohydrates. After a week or so, then we have what is called as the mature milk, which is produced and which is fulfilling the baby's appetite. What are the advantages of breastfeeding? First, we will consider the advantages to the baby. It helps in the gastrointestinal development and function. It helps the immune system to develop. It helps in the cognitive development, the brain development of the baby. Infants breastfed have reduced risk of infection as compared to the formula feed infants. Breastfeeding, if we consider the long term benefit to the baby, during its entire lifetime, the baby has a lesser incidence of obesity, lesser incidence of some cancers such as Hodgkin's lymphoma, leukemia, and even type 1 diabetes. It has lower risk of infections such as otitis media, lower respiratory tract infection, diarrheal diseases, allergies, eczema, meningitis, and inflammatory bowel disease. So all these are prevented. Breastfeeding is an easy and affordable milk to the baby. No one has to go and buy something for the baby, and therefore, this gives the best milk to even socially downtrodden families. And this is very important. As per the World Health Organization guidelines, each and every mother should be told the importance of breastfeeding, and this breastfeeding should be initiated within 30 minutes. Amidst this COVID pandemic in which we are right now, even those mothers who are considered as COVID positive are also allowed to do breastfeeding with appropriate care. So they have to use a mask, they have to follow all standard precautions, but they can definitely breastfeed their baby. There lies the importance of breastfeeding. Even in this pandemic, the organizations, as healthcare professionals, we are telling the patients to breastfeed their baby and to practice rooming in practices. What are the advantages of breastfeeding to the mother? So it will reduce the post-delivery bleeding, and this is very very important. It allows the uterus to convolute. It allows the uterus to contract on itself, and this will reduce the bleeding, and therefore it will reduce the postpartum incidence of anemia. It also will cause some hormonal changes in the body. It will lead to the rise in prolactin levels, which will continue to secrete this breast milk. There will be oxytocin release, which will initiate the final ejection of milk outside, and this inhibit the ovulatory hormones FSH and LH, and therefore this will act as a contraceptive. This is called as a natural contraceptive or lactational amenorrhea method of contraception. So this will delay the next pregnancy. It will protect the woman against breast and ovarian cancers. Now, this use is very, very important. It has been shown in the research that those women who don't feed their babies, who are not pregnant anytime in their lifetime, have a very, very high risk of breast and ovarian cancers in their lifetime. And therefore, breastfeeding is very, very important. It has been shown to reduce the incidences of these cancers. It will also help the woman to prevent obesity and shape alterations in the body. It will also prevent some diseases in the woman which are more due to them not being pregnant. So the problems or diseases associated with hyperestrogenism can be prevented if the mother breastfeeds a baby properly. She'll not have a periods for around 5 to 6 months, maybe probably more than that if she adequately breastfeeds her baby and the breastfeeding is adequately initiated. For the family, it will have a low cost baby feeding alternative, less illnesses, more of a family bonding, and more of a human resource and economy development associated with this. Now we talk about the technique of breastfeeding. So we have different positions, different aspects how we can practice the breastfeeding. So initially during the pregnancy period itself, we'll have to see the nature of the breast, the examination of the breast. The breast size should be adequate. The nipples should not be uh, retracted, so that during after delivery, immediately after delivery, there is breastfeeding which can be started immediately after that. So therefore, the latching of the baby to the breast is very, very important. So baby has to grasp not only the nipple but a part of areola also, and this is called as latching. And this latching is very, very important so that the baby adequately stimulates the areola to cause breastfeeding, the secretion of the milk. Now, what are the differences between various types of milks we see? So we have the human milk, the cow milk, the buffalo milk, which we commonly use, and the human milk is the most physiological for the baby. It contains high quantity of lactose, a very small quantity of protein and fat, and therefore it is very easy to digest this milk. It has got high content of anti-infective proteins, immunoglobulins, which are very, very important for developing the baby's immunity. If we consider about the essential fatty acids and the enzyme lipase, these are present only in the human milk, and therefore it helps in digestion of whatever fats are there that in the breast milk. If we consider different amounts of vitamins in the milk, human milk contains lots and lots of vitamin C and vitamin A, which are poor in cow's milk, which contains more of B complex vitamins. If we consider about iron in the milk, human milk contains around 50 to 70 microgram of iron per 100 ml, and then the cow's milk, which contains very, very poor content of iron. So this is about the human milk. So we have some alternatives to breastfeeding, which should be evaluated and benefit. If we see, we should see if what is the best alternative to breastfeeding. So the best alternative to immediate breastfeeding is the express breast milk. So that milk of the mother, if the women are office going, they don't have that time to stay with the baby, then in those cases express breast milk is the best alternative. Other than that, we have milk banks where we have milk which is has undergone pasteurization, and this milk of another healthy woman which has been stored in adequate conditions. So this is are called as milk banks, often termed as Yashoda, who used to feed Krishna, who was maybe we can call her as a surrogate mother, where she used to feed Krishna, and that was the practice. That was old centuries old things which we can see. So how we can store breast milk, so that is whatever is the best alternative, that is the express breast milk. So in the room, the breast milk can be stored for around 6 to 8 hours. If it needs more storage, we can store it in a refrigerator in a temperature of 4 degrees Celsius for up to 5 days. But if we want a long-term storage in a milk bank or so, we can store it at minus 15 degrees Celsius for 2 weeks, minus 18 degrees Celsius for around 3 to 6 months, and for at minus 20 degrees Celsius for around 6 to 12 months. So that is how we can store breast milk, and this can be later on thawed and given to the baby. Other alternatives to breast milk are formula feeding, uh, which are usually as provided as powders, and this can be reconstituted with the use of sterile water, and then we can feed it to the baby. Alternatives other than this, like simple water, honey, or milk from animals such as cow, buffalo, will not be prudent for a newborn, because this exposes the newborn to high amount of infection and predisposes it to infections such as otitis media, diarrhea, meningitis, and so on. So we were talking about different breastfeeding positions. So normal positions in which the mother holds the baby is the cradle hold position, where the infant's head is supported in the elbow, the back, and the buttocks, and the baby is held in a cradle hold position. After that, we have the football holding position. As we hold the football, in that case, the infant is placed under the arm, the baby is supported with the forearm, and the head is supported with the hand. This is a very good position, especially for those women who have undergone an operative procedure. Usually, the woman who can also have an easier position. It is a side lying position. We usually don't recommend this because the chances of aspiration of milk, chances of infections are more in this position. So the mother lies on her side and propping up her head and shoulder with pillows. The infant also is lying with the mother. This is usually recommended for those who have undergone a cesarean section, but mm, if they can just lift up their head and feed the baby in an upright position, that is better. We have something called as the cross cradle position, where the opposite of the cradle holding position can be practiced. In cases of twins, we can have any of these positions. If they need the feeding immediately at the same time, then we have a twin football hold position which can be practiced. After that, we have the Australian hold position, in which the baby is rested on the mother's knee and the knee is brought closer to the breast, and then the baby is fed. This is not a common position which we practice. However, it needs a mention that this is also a position. What are the barriers to exclusive breastfeeding? So, if there is mother is not confident, if there is problems with the nipples, if she has a belief that the breastfeeding is insufficient, so usually in the first 2 or 3 days, the feeding is going to be ready a little bit less, and we have to counsel the mother that once she starts feeding her baby, only in that case the feeding is going to increase. Lack of adequate support system for breastfeeding may sometimes cause hampering in effective breastfeeding. History of previous breast surgery, breast engorgement, and sore nipples, cracked nipples can also lead to uh, problems with breastfeeding. Any psychiatric disorder in the mother or embarrassment can also lead to inefficient breastfeeding practices. What are the contraindications? So, in which conditions we absolutely don't breastfeed? So, we have what is called as the HIV or HTLV infections, where this can predispose the mother to the baby to the infections. Here, we can shift on to complete formula feeding. So, middle way practice should not be done. So, alternate formula feeding and breastfeeding should never be done, because this predisposes the baby to more and more amounts of infection. So therefore, a complete breastfeeding, even if HIV is there and they are not affording formula feeding, in those cases we should advise breastfeeding. But if they are affording breastfeed formula feeding, in those cases, for a HIV positive mother, feeding her baby is not warranted. If a mother has got active tuberculosis, in those cases, we may defer breastfeeding. Infants born with inborn error of metabolism can have problems with the milk, that is the lactose content, and these are galactosemia, phenylketonuria, and so on. Mothers on certain medications like anti-cancer therapy, radioactive isotopes should not breastfeed their baby. Barriers to bonding takes place whenever we are using bottled milk or any other form of milk. So therefore, breast milk is a very important aspect to feed. If there is some problem such as cracked nipples, sore nipples, or patient is not able to feed the baby actively, in those cases we can use a breast pump, which can be electric or manual, and then a cup or bowl feeding can be initiated. A spoon feeding is always better than a bottle feeding, and bottle feeding should be discouraged. This is about breastfeeding. Breastfeeding initiates short-term and long-term advantages to the mother and the baby, as we have seen. It will complete the process of motherhood, complete the process of womanhood, and make a woman a better person, both physically and mentally. It will improve the bonding between the mother and baby. So can we pledge as uh, good human beings, can we pledge together to breastfeed the baby, improve the breastfeeding practices? More and more mothers should breastfeed so that we have a healthy generation coming out, especially out of this pandemic scenarios. Thank you so much. So we'll take up some questions. What is breastfeeding jaundice? So there is something called as physiological jaundice, which sets in immediately after delivery, after 48 hours, and this can be there for around 7 days of life. This is due to inadequate liver enzymes present during this period, and after 7 days, this will pass off. Other than that, breastfeeding per se will not predispose the baby to any sort of jaundice. So this is a misconception that breastfeeding will cause a jaundice in itself. What are the benefits of using a lactation aid? So we all know that lactation is very important, and aids along with it, which if we have, then that will help breastfeeding a baby which has the mother has a problem with the breast, the mother has sore nipples, retracted nipples. In those cases, devices such as breast pumps, manual or electric, and other techniques of lactation help would definitely be helpful for such a woman. Can one breastfeed if she's having diabetes? Yes, definitely. Uh, Infants born out of diabetic mothers, they will have immediately after delivery, they will have low sugar levels. This is because high insulin content of their blood transmitted from the mother. The mother has got hyperglycemia, so the baby in uterus will have hyperglycemia, and this will contribute to high insulin levels. This immediately after delivery will cause utilization of glucose, and this will cause hypoglycemia or low sugar levels in the baby. Also, along with it, will the baby will have hypocalcemia, hypomagnesemia, and all these ill effects can be prevented with the help of breast milk. If you are supplementing the baby with breast milk, the baby of a diabetic mother, this will definitely help the baby to be preventing all these complications immediately afterwards. So definitely, a woman with diabetes should also breastfeed the baby, and it will definitely be helpful for them. What foods upset a nursing baby's stomach? So usually there is no food which is contraindicated in breastfeeding. However, medicines which are not which can be transmitted through the milk should be avoided. Foods which are extremes, like too spicy, too oily food should be avoided whenever we are breastfeeding. feeding, which is foods which are high content of protein, high liquids should definitely be taken when a mother is breastfeeding her baby. Ample of milk intake should be taken by the mother. Usually, the diet which we consume contains less amount of protein. Therefore, protein supplements are also needed when the mother is lactating. So, this care should be taken by a mother who is lactating. How can one treat blocked ducts and mastitis? So, usually, this is a complication of inadequate feeding or in proper cleaning of the nipples immediately after feeding. So, all this can be prevented. First and foremost thing is that feeding of the baby should be adequate. If you feed the baby adequately, then your breasts are going to be empty, and this will not lead to a higher risk of infection. Once, if the baby is inappropriately feeded, inadequately feeded, then the breasts will be full of milk, and this partial or fullness of the breasts will lead to a constant source of infection, and this can obstruct the ducts. This obstruction will lead to sometimes called as mastitis, and this can also lead to breast abscesses. So once after your feeding is done, you should clean the nipples. Excess milk which is there in the breast, if present, should be expressed out after the feeding. Usually, once the baby takes a feeding on the right-sided breast, the next feeding should be on the left-sided breast, so that both the breasts become empty and there is no risk of infection. So this care has to be taken immediately after feeding and before any next feeding. The nipple should be cleaned properly with a warm water, and then the feeding should be started. Okay. How will I know that the baby is getting enough breast milk? So, usually, babies feed around 2 to 3 hours, every 2 to 3 hours, but may not be always so. So, we suggest feeding on demand. However, initially, the mother may not be able to do this feeding on demand because she doesn't know how the baby will respond. So usually a feeding every 2 to 3 hours is recommended. This feeding is initially of 5 to 10 minutes duration, which will may up to increase up to around 30 to 30 minutes duration, 20 to 30 minutes duration. The baby, if it takes feeding adequately, will pass urine around 5 to 6 times in a day. So if the baby is passing urine, if the urine color is whitish yellow or white, then that's considered as the adequate feeding. If the baby is not passing feeding, if the baby is not passing stools, then and the baby is crampy, crying, then this indicates that the baby is not receiving feeding adequately. So if the baby is silent, baby is taking the feed adequately for 15 to 20 minutes, sucking properly, passing urine, passing motions, this indicates that the baby is getting enough breast milk. Also, along with this, the baby will put on weight. So during the first 7 days of life, the baby tends to lose weight because of the excess water content. But after 7 days, the baby will start putting on weight, and this is around 300 to 400 grams per week. So definitely, this will also help you to tell whether the baby is getting enough breast milk. Uh, is it common to have uneven milk supply? So basically, if the feeding is inappropriate, if you discontinue feeding in between, or if the baby is not able to suck, or if there is any other physical problems with the breast, this will lead if that infrequent feeding is practiced, then this will lead to a hormonal profile which is not favorable for breastfeeding, and this can lead to uneven milk secretion. Some medications, if used, can also cause improper milk secretion. So, whenever you are breastfeeding the baby, the medications which you are taking should be always be taken with a doctor's consent and prescription, and therefore, this uneven milk supply can be prevented. Does breastfeeding affect a mother's breast? So it affects definitely. Uh, Whenever the mother is pregnant, there are high levels of hormones which will cause changes in the breast and prepare them for lactation or feeding the baby. Once delivery occurs, the oxytocin release will cause a milk ejection, a reflex, and this will start the breast milk to flow. Once the baby starts sucking the breast milk, this will start increasing, and therefore, definitely, the glandular area of the breast hypertrophies, and this will cause changes in the breast, which are favorable for feeding the baby. This helped the breast in much good way in the long run. This will prevent incidences of tumors in the breast which are benign. This will also prevent cancerous growths in the breast, and therefore this short-term changes in the breast usually get reversed. So the enlargement of the breast, the change in the size of the breast, change in the contour color of the breast will all get reversed. But whatever physiological changes have been occurring in the breast, and for to initiate the breast milk feeding, will help the mother or help the woman in long run to prevent serious diseases in her. Can we have the next question? Yeah. When should a baby not breastfeed? So, as I told you, if the baby has got any inborn errors of metabolism, like it is not able to digest lactose in the breast milk, such as galactosemia or phenylketonuria, these babies will not be able to. So this baby will not be able to breastfeed because of decreased decreased utilization of lactose because of the enzymes which are absent. HIV positive woman, if they can afford formula feeding, should not breastfeed their infant because there is a risk of transmission of the virus through breast milk. Other than this, usually there is no absolute contraindication to breastfeeding. Even COVID positive or corona positive mothers can feed their baby with a mask on after cleaning the breasts. If the mother is not lactating, can powder milk be given to the IVF baby? So IVF mothers usually they will have proper breast development because they are going undergoing a pregnancy, and therefore I don't see that IVF mothers should not why they should not feed their babies. As we know that IVF mothers can have a higher age group, they can be more than 35, or maybe in these patients, if other associated conditions are present like hypertension, heart disease, or something which is causing problems, can cause a decreased breast milk secretion. However, all these women should breastfeed their baby, even if they have undergone IVF. That is not an excuse that why they should not breastfeed their baby. Only in those patients who where the lactation is not established properly, where the breast milk secretion drops down because of age or multiple other factors, then in those patients we can have use the alternative of breast milk, which is usually a formula feeding powder, which is prepared in a proper way and then given to the baby. But this is just an alternative. As we have said, breast milk is the best important thing. Breastfeeding, directly feeding the baby to the mother's breast, is the first option. Second option is express breast milk. Third option would be to give milk from a bank, that is a milk bank. Then, along with that, if that is not feasible, or if the patient doesn't want that, then a formula feeding option is always there. Should one stop breastfeeding if she's sick? All sickness or all illnesses, they do not should stop. They should not stop breastfeeding. Any specific disease where the woman is likely to transmit that infection to the baby, in those cases only we advise not to breastfeed. Infections such as active tuberculosis, active herpes infection, where the breast skin over the breast is affected because of herpes, these infections will prevent breastfeeding. As we have already said that HIV infections, HTLV infections are there where she should stop feeding. So only in these acute illnesses she should stop breastfeeding. Otherwise, one should not stop breastfeeding during any time during the 6 months where the exclusive breastfeeding is practiced. Can working mothers breastfeed? They should breastfeed. I said that there is no excuse for breastfeeding. Working mothers should also breastfeed their babies. If it is not feasible for them to actively feed them on their own breasts, they should do express breast milk secretion. They can aspirate the breast milk with the help of manual breast pumps or electrical breast pumps, and this milk can be safely be kept for 2 to 4 hours out of refrigerator. If for longer period, they should be the milk should be kept in a refrigerator at 4 degrees Celsius, and this can be used for hours together. So, working mothers can definitely breastfeed their babies, and they breastfeed their babies so that they have a good immunity, and they themselves, the working women themselves, can have a better lifetime without any diseases of the breast or other serious disorders. So I think that those were the questions about breastfeeding. I thank you all for a patient hearing. At Oasis Fertility, for our IVF patients also, do encourage breastfeeding. This is August month. At the end, we are at the end of August, and I would urge all mothers, whether they are IVF conception or natural conception, to kindly breastfeed their babies. Pass on this video to all eligible mothers. Log on to oasisindia.in for more information. We are there to help you at Oasis Fertility Pune. Our location is at Dynasty Commercial Wakat. So any of one who wants to consult us for any such issues can definitely see us. Our toll-free number is mentioned on the screen. Thank you so much for your patient hearing.